Tumors of the brain. Generally, tumors are of two types, cancerous and non-cancerous, otherwise generally called malignant and benign. Unlike in other parts of the body, this distinction between cancerous and non-cancerous is not as important as in brain, because any tumor in the brain can be very alarming or potentially dangerous. It's because the brain is all electrical activity, and each part of the brain, dominant hemisphere, non-dominant hemisphere, speech area, hand area, leg area, area concerned with vision, language, memory, each area, like a printed circuit board, is generally represented in a particular area of the brain. So if a tumor occurs in a particular area, that work of the brain will be affected. So irrespective, it may be a very small, tiny tumor, but in a very important location, it can have disastrous results. Whereas sometimes tumor can be very big in a non-eloquent area. That means the area which is not in a particular function related. So there can be large tumors with very minimal effects. They may come with some vague headache, vomiting, vision disturbances, memory disturbances, smell. You remember the COVID time. Similarly, some areas of the brain, skull base, where it can show as absence of smell, hearing loss. So it can happen in various ways. Generally, the common forms of tumors are called gliomas. Gliomas are the tumors within the substance of the brain, which can be highly malignant, called glioblastomas. Or meningiomas. These are the tumors from the covering of the brain. They are generally slow growing and benign. Some particular areas like pituitary gland, we get pituitary tumors. We operate through the nose, through an endoscope to remove that. And vestibular schwannomas. So that is in the back side of the brain, where it is concerned with the nerve of balance and hearing. So these are some of the common tumors, to name a few. With advances in technology, there are various ways to safely take out these tumors and give a very functional outcome so that the person can get back to his normal life without any deficits or problems related to the tumor or the procedure. Mainly, there is an instrument called microscope, operating microscope, which is a huge machine which occupies 1/4 of the room in our operating room. All of our cases for brain tumor surgeries, we use this operating microscope. We zoom it using the microscope, and with millimeter precision we can find out where the tumor ends, where the brain starts, which are the important areas of the brain. There's one more peculiar instrument which we use. It's a workhorse in our operation theater. It's called navigation. You'd have heard of GPS navigation when you travel in roads. We are used to using maps. Similarly, when we navigate inside the brain, we use what we call neuronavigation. That will show where exactly the tip of our instrument is, how much of tumor is taken out, how much it is remaining, what is the important area next to it, where we need to stop. That's an important advancement, technological advance, which is our workhorse. In each of our tumor cases, we use it so that we can safeguard the normal structures and precisely take out the tumorous condition. And we have another technique which is called awake craniotomy. Awake craniotomy is a procedure where we keep the patient awake during surgeries. Like during dental procedures, you will be awake. Like that, when we are operating on the brain, the person will be awake. It is a very important thing to keep the patient awake, because As we are operating, if we are close to any important structure, the patient can give immediate feedback. If the language, if the speech gets affected, if the hand or leg movements, finger movements get affected, we will know immediately and we can stop there. We can avoid transgressing to those important areas. That's a very important technique. It looks something difficult, but actually the patients will actually undergo this procedure quite happily because they know that will give safety. They will be awake, they will be responding, they will be seeing TV, they may be seeing cricket, or they may be seeing their own brain getting operated. That is awake craniotomy. So these are some of the technological advances like neuronavigation, that's our GPS within our operating room, awake craniotomy, and use of operating microscope. Three important technological advancements over and above the advances in radiological techniques. MRI, 3 Tesla magnetic resonance imaging. This will precisely show, and including there are ways in which we can trace the tracts, the normal fiber connections within the brain with advances in radiological techniques, which will give us precisely the anatomical orientation to take out the tumors safely. So there are various different kinds of tumors which can affect the brain, and with time we have come to a stage where we can confidently say that most of these tumors are amenable for treatment with very good outcome so that the person can get back to his normal life.